Now, the Water Research Commission is monitoring wastewater for COVID-19 infections, this in various communities. But the first of the three-phase program was successfully completed back in September, and today it will brief the water sector as well as members of the public on the second phase. Now, Bhagwan from the Commission joins us now this morning to discuss this further. Jay, good morning to you. Thank you so much for your time. I mean, just for clarity's sake and perhaps keeping us to speed here, when it comes to water waste, can it or has it accounted for some of the COVID-19 infections that we've seen in the country?
Well, let me put the records, straight for the viewers that what we're looking at is remnant particles of the COVID virus. So any infected individual that uses a toilet that flushes, would release a lot of these remnants that are non-infectious, okay? And these remnants in the form of a protein, which we call the RNA, is something that has a very specific signature. And we are able to monitor this signature at the end of the sewage network, just before it enters the wastewater treatment works. And through the science and methods we have, we're able to isolate these proteins and quantify the kind of level of infections in a community. Now, one of the big advantages it offers is that, clinical testing is required for infected people that go for tests. But through the wastewater-based surveillance techniques, we're able to also pick up the asymptomatic cases as well, as a load, to give you a more better approximation of what is happening in a community that is served by the sewer network.
That's interesting, Jay. And I understand that the first of three-phase programs was successfully completed just this past September. Take me through that.
Yes, so, it's very important that we're dealing with a very new virus and, some of the scientific methodologies for sampling and testing needed to be established properly before we rolled it out on a wider scale. Now, this has to be seen as a complementary activity to clinical testing. We're not saying that clinical testing should go away, but what it does is that it positions us to, in a very cost-effective manner, set up an early warning and a hotspot planning regime that health authorities can zoom in. So in the first phase, we established and confirmed the science around the methodology and sampling. We launched today the second phase that organizes us as through a pilot of sorting out the logistics of how different institutions become part of organizing to roll out this program on a continuous basis that would then serve as a decision support mechanism of what is happening in communities. And we will be able to pick up the trends on the increases and decreases and actually be able to zoom into areas in the sewage catchment that are of huge concern that we can then tackle with education and awareness at a local level. So it has many, many benefits.
Right. And also understand that this was part of the reason why you'll be briefing some of your members as well as the water sector about, the second phase, but also how you're monitoring some of the provincial hotspots. But interestingly, you're also doing this, I understand, to almost detect, the second wave, or if there will be this resurgence of COVID-19 that we constantly hear about.
So, if you look at globally and internationally, we're already starting to see the second and third waves emerging in a significant way. And I think we cannot be complacent about our own circumstances. We're heading for the holidays. People have been locked down for a long time. They're missing their families. So we have to plan for the possibility, and rolling out this program is very key in establishing that platform that allows us to manage this pandemic on the long-term basis. We don't see it going away in 6 months, etc. It's going to be there for us. So this wastewater-based process offers us to build a longer-term institutional platform around monitoring many, many other pathogens. And COVID is just the opportunity that accelerates the capacity in the country to organize ourselves logistically to do this.
Well, Jay, thank you so much for talking to us and clarifying that for us. Jay Bhagwan there from the Water Research Commission.